All right. Well, good afternoon, everybody. Thank you for joining us today as we gather in this virtual space to discuss a critical issue. Um, the proposed budget resolution that aims to dramatically cut Medicaid funding. It's my pleasure to introduce our partners at Justice and Aging, Hagar Dickman, Director of the California Long-Term Services and Supports Advocacy, and Natalie Keene, Director of Federal Health Advocacy. Hagar and Natalie will walk us through what this resolution is, what it means, and what you can do about it. So thank you both for joining us. We're going to invite them to the stage and then pull up slides as well. Here we go.
Great. Well, thank you so much, Maria. This is Natalie Keene. And yeah, Hagar and I are excited to be with you today. Very, very timely topic as things are happening on the Hill right now. We'll go ahead to the next slide. So I imagine most of you are familiar with Justice and Aging and our California work, but we are a national organization that uses the power of law to fight senior poverty, working on access to affordable health care, economic security, and the courts for older adults with limited resources. Next slide. So we're going to start with a refresher on Medicaid and all the important ways that it helps older adults and people with disabilities and people with Medicare as well. Next slide. So nationally, more than 7 million older adults and 10 million people with disabilities rely on Medicaid. And many people are really not aware of how important Medicaid is for seniors or people with disabilities and people with Medicare coverage. Medicaid is very broad and covers a lot more than traditional medical services, as I'm sure all of you on this call are very familiar. It covers home and community-based services, nursing facilities, non-emergency medical transportation, as well as financial assistance for Medicare beneficiaries who are duly enrolled in Medicaid. I like to say that Medicaid makes Medicare accessible and affordable for these individuals. Long-term care is especially an important role for Medicaid. It's often older adults' only option to be able to access long-term care. It covers more than 60% of nursing facility residents nationwide, and more than 70% of HCBS spending nationwide. HCBS is often provided through waivers and helps older adults age in place. And as we know, it's very expensive and cannot, be afforded by most people out of pocket. Medicare coverage of long-term care is very limited. So again, just emphasizing Medicaid's important role. Next slide. So a little bit more specifically about Medi-Cal, more than 2.3 million older adults and people with disabilities rely on Medi-Cal. California receives $112 billion in federal Medicaid funding. Medi-Cal covers these services that Medicare doesn't, including dental, vision, hearing, long-term care, and transportation. 1.75 million duly eligible individuals rely on Medi-Cal to pay their Medicare premiums and/or out-of-pocket costs. These are individuals who have very low incomes and often very high healthcare needs. The Medicare savings programs, again, make Medicare affordable. There are over 900,000 older adults and people with disabilities who are receiving long-term services and supports through Medi-Cal. This includes IHSS and other HCBS that help older adults age in place, as well as 2/3 of California's nursing facility residents. Next slide. Now we're going to get into what's happening with the Medicaid threats that we're seeing in Washington, D.C. right now. On the slide, there are kind of two buckets of threats. These are the types of cuts we're seeing discussed as part of the budget resolution that's calling for a minimum of $880 billion in cuts to the Medicaid program. The bottom line is that any of these cuts would be devastating for older adults and people with disabilities. And I'm going to go through later on in more detail each of these cuts and what they would mean. Next slide. So the current moment, because Republicans control the House, the Senate, and the White House, they can utilize what's called budget reconciliation to move legislation with only 51 votes in the Senate. Normally, 60 votes are required in the Senate to pass legislation. So this is a way for right now the Republicans to fast track their legislative priorities. And one of their biggest priorities is to permanently extend the tax cuts that primarily benefit wealthy individuals and corporations that were passed last time Trump was president. And so in order to do that, they are looking to offset those tax cuts with other spending cuts. And that's why Medicaid is particularly in the crosshairs right now. So budget reconciliation does have specific requirements, most importantly that the bills passed through this process have to relate to the budget and not add to the deficit. So again, that's why in order to extend their tax cuts on the revenue side, they're looking to cut spending. Next slide. So these are an overview of the steps of the reconciliation process and the timing of what we're seeing for the fiscal year 2025 reconciliation bill. So the first step is for the House and the Senate to adopt the same budget resolution. Last week, the Senate passed its own budget resolution, and right now, today, the House is voting on their budget resolution. The two resolutions are very different, and to be clear, for any legislation to be enacted as a result, the House and the Senate do need to agree on the same budget resolution. The resolutions are not law. They are high-level instructions to committees to generate revenue or savings. So after the budget resolution is passed, the next step is that the committees write and mark up their bills. And this is where we'll see cuts to Medicaid spelled out. So for Medicaid, in the budget resolution, we're looking at instructions to the House Energy and Commerce Committee and the Senate Finance Committee, who have jurisdiction over the Medicaid program. Noting, again, the Senate and the House are at very different positions right now on their two resolutions, but the step two of committee work on their bills could begin in the respective chambers before they agree on a resolution. The final step would be for the House and the Senate to vote on their reconciliation package. The House is likely to vote first because they have a narrower margin of majority. So, it's important that the House is able to pass whatever ultimately would be sent to the Senate. Um, there could be a lot of amendments and back and forth between the House and the Senate. And right now, Speaker Johnson and Majority Leader Thune are saying that they want to pass a package by May or June. That's an aggressive, ambitious timeline. So it certainly could slip, but we need to be ready now and moving forward in case they are able to act that quickly. A little bit more about the budget resolution. As I mentioned, the Senate's resolution is smaller, but it still calls for $1 billion in cuts for finance and energy and commerce. Um, we are certain that this would include rolling back the nursing home minimum staffing rule that I'll talk about more later. And more importantly, we know that even if a smaller resolution like this passed, a second package with even larger cuts would be coming. So we have to be vigilant again to protect Medicaid for the next 2 years. Even if we get through this FY 2025 budget resolution, the reconciliation process could be repeated for FY 2026 later this year. Again, unclear whether the Senate's smaller bill will prevail or the House's or somewhere in the middle. And so they could be repeating the process. We could also see Medicaid cuts in bills about the debt ceiling and the FY 2025 appropriations. Those, if they're outside of the budget reconciliation process, do require 60 votes in the Senate. But again, places to be vigilant for any type of Medicaid cuts or restructuring. So, bottom line again, to prevent cuts, we have to engage before and during each step. We're, aiming for a preemptive strike. And so right now, as the House is deciding whether to move forward on their $880 billion resolution that would call for massive cuts to Medicaid, we need to be, trying to stop that from happening. If it does move forward, we still have many, many opportunities to fight these cuts from becoming law. Next slide. Okay, so diving in more to the types of cuts that we are hearing discussed. The biggest one in terms of meeting that $880 billion number is per capita caps or block grants. So per capita caps would limit Medicaid funding to a set amount per enrollee, whereas block grants would give California a lump sum of federal funding, with the state having a lot of discretion on how to spend those funds. In either case, the caps on these fundings would be set below actual healthcare spending and designed for deeper cuts over time. They're designed to save the federal government money. So that's especially harmful for older adults and people with disabilities who have a lot of healthcare needs. From the CBO estimates, you can see why these types of caps on funding are at risk when we're seeing calls for $880 billion in cuts. These types of funding caps would generate those sorts of cuts exactly. Both block grants and per capita caps would fundamentally end the Medicaid program as we know it. It would end the federal funding guarantee and shift a lot of costs to California. Next slide. So the second type of funding cut that we're hearing a lot about is cutting the federal medical assistance percentage or FMAP. This is the fancy term for how much the federal government um, uh, reimburses California for its Medicaid expenditures. Currently, the federal government pays at least 50% of California's Medicaid expenditures. So the types of proposals being considered are removing that 50% floor. So California wouldn't be receiving 50% reimbursement anymore. This would shift more costs to the state. California would be paying more for Medicaid coverage. There's also talk of ending the enhanced 90% FMAP for ACA expansion, which would also greatly increase costs to California. So this was part of the deal with when the ACA was passed, was that the federal government would pay no less than 90% of the costs for this new population. And it's really helped states like California do amazing things with their Medicaid program. Um, we've also heard a lot of talk about a per capita cap for the expansion population only. This would have a similar impact to ending the enhanced FMAP for that population. And in California, it's important for us as advocates for older adults and people with disabilities to remember how many older adults and people with disabilities receive expansion Medicaid, either because they're not eligible for Medicaid based on their disability or age, um, or they're waiting. They're not old enough yet, or they're in the waiting period to get their Medicare coverage started, for example. Next slide. Um, the third item, third threat on the list in terms of federal funding is the federal government could put a restriction on how California funds its share of Medicaid costs. Um, California, just like almost every other state, uses provider and insurer taxes to help fund their share of Medicaid costs. Some examples in California are the hospital provider tax and managed care organization or MCO tax. Again, as mentioned on the previous slide, California is responsible for half of its costs. So, but that federal federal match comes in the form of a reimbursement. So California has to spend the money first before it can receive money back. So restricting allowable provider taxes and sources of revenue for the state would mean that California's uh, budget will shrink. They'll again be forced to cut Medi-Cal services because they won't be able to fund their own share of costs. And these effects will get worse over time because California won't be able to draw down as much federal funding, and it'll impact programs beyond Medi-Cal. Next slide. So the other bucket of cuts that we're hearing a lot of talk about are, changes to or restrictions on enrollment and eligibility. So the one that we're hearing the most buzz about is work requirements. And these are nothing more than a cut by another name. They would add red tape for people who are eligible for Medi-Cal, requiring enrollees to submit paperwork on a regular basis. Typically, work requirements are focused on people eligible through the Medicaid expansion and other adults whose eligibility is based solely on income, like parents. But just there's no way to carve out older adults and people with disabilities from harm. As mentioned previously, there are a lot of people with disabilities, a lot of older adults who aren't yet 65 and Medicare eligible, who rely on expansion Medicaid for their health care coverage. And also, a lot of paid and unpaid caregivers for seniors rely on Medi-Cal for their own insurance. On top of this, we've seen in states like Georgia that currently has a work requirement in place that it adds a lot of administrative burden that impacts all Medicaid enrollees, including older adults. States like Georgia are spending a lot of money on these administrative costs, and it's mucking up the rest of the system, slowing down applications for Medicare savings programs, for A&D Medicaid, and also even SNAP, so even outside of the Medicaid program. There are some proposals that would make work requirements optional for states. And it's just really important to message that this does not mean that California is safe. It's adding work requirements at the federal level is a fundamental structural change to the Medicaid program, and Congress could more easily make them required of all states in the future. Also, California might choose to pursue them under different leadership in the future, especially if their budgets are tight. Next slide. So the final category of cuts that we're hearing about are repealing regulations. So there are three regulations that we especially have our eye on from the perspective of Medicaid, that are the streamlining Medicaid eligibility and enrollment rule, the nursing home minimum staffing rule, and the Medicaid HCBS access rule. So all of these rules are really aimed at improving access and the quality of care. The streamlining rule removes barriers to an enrollment, barriers to enrollment and barriers to continuity of coverage for people who are already eligible. The minimum staffing rule and HCBS access rule increase transparency and ensure that Medicaid funding is going to the actual provision of care. As I mentioned before, the Senate budget resolution is we're being told that rolling back the nursing home minimum staffing rule is being contemplated as part of the Senate's budget resolution. I think all of these rules are certainly on the table for being rolled back under the House's budget resolution. And with these rules, because they are regulatory, we could also see the Trump administration take action to roll them back as well. We could see them doing additional rulemaking to rescind or delay implementation of these rules. And we're likely to see the Trump administration approve state demonstration waivers that restrict eligibility or benefits. We've seen several states already apply to implement work requirements. There are other proposals to eliminate retroactive coverage or charge premiums or cost sharing. Next slide. So how these cuts could impact older adults, and this is really where the rubber meets the road. Less federal funding translates to state budget shortfalls, which will force cuts. And states really have three options when they have less money. It's to cut optional benefits or eligibility categories. And a lot of the programs on this list and a lot of the eligibility pathways that seniors and people with disabilities rely on every single day are optional under federal law, not mandatory. So this means that programs like IHSS or other HCBS will likely be the first to be cut if California is facing budget shortfalls. They could also cut enrollment, rolling back expansions of the aged and disabled or Medicare savings program eligibility. Um, they could cut provider payment rates, and we know this would severely harm access to care, worsening the direct care workforce shortage that we're already facing. Next slide. So I'm going to leave you with a few key messages before handing it over to Hagar to dig in more on California specifics. But again, all of these proposals, whether they're called reforms, whether they're called addressing, waste and fraud, they're really all cuts at the end of the day. And the reason why Congress is considering them is to generate federal government savings to pay for tax cuts and other priorities. States will lose money, be left holding the bill, and be forced to cut to fill the gap by cutting benefits and or eligibility. There's no way to carve out or shield older adults and people with disabilities from harm from any of these cuts. And finally, a cut to Medicaid is a cut to Medicare. 30% of all Medicaid spending supports people with Medicare. So we need to make sure that Congress understands that. And I will now hand it to Hagar.
You. So I'll just go over a few areas where we should really be thinking about, like, how is this going to impact us in California and all the work that we've been doing here to really ensure that people, that older adults and people with disabilities who need services can access them. Really, because of the high federal participation rate in California, the 50% participation rate here, a cut in California will have significant impact on the California budget and will really force our state, our legislator, and advocates to really think about where it is that where we're going to be having to cut in order to maintain any sort of Medicaid spending in the state. And home and community-based services programs like IHSS are the most likely to be impacted first because they are both more expensive and they are optional for the state. So next slide. So we have 2.3 million older adults and people with disabilities who rely on Medi-Cal. And like we had talked about before, California receives $112 billion in federal Medicaid funding, and even just a portion of that amount is going to have significant impact. And I know a lot of people on the call don't need to be reminded that we already had, in 2013, had a budget shortfall that caused significant cut to IHSS hours, where we had across the board 8% reduction in IHSS hours, and that was a very significant burden for all of the IHSS recipients out there that were relying on those hours for their care. And so thinking about that and how any sort of budget impact can really force a reduction in services for Californians is a good reminder. Medi-Cal, because Medi-Cal doesn't cover, Medicare doesn't cover a variety of necessary medical services. Those are optional for the state, and we've decided in California to expand access to those services like dental, vision, and hearing. And those will also be a place where the state might want to look first in order to find some covering some savings. And then, so why don't we go to the next slide and we can kind of dig in a little bit more. Here are the optional Medicaid services that are at risk. And again, the most expensive of those services will be our home and community-based services programs. We have the community supports and enhanced case management services that we've added to CalAIM through managed care. And I think it's also important to kind of think about where is it that California, what are the optional things that California has done that could first be rolled back? And those are not just the services, but really the expansion categories. We've expanded coverage for the aged and disabled category of Medi-Cal to 138% of the federal poverty level. Um, Even though that is a low income limit, it used to be much lower, and we could see the state deciding that they need to roll back that income limit in order to cover less people, and they could have some state savings in that way, and also rolling back coverage for undocumented individuals that we've just finished implementing last year. And again, we've already seen attempts to do this at the last economic downturn last year when there was a budget shortfall. There was an attempt or a suggestion to reduce IHSS access to undocumented immigrants. And so we can assume in the future that there may be those are areas in which the state might look to in order to find some Medi-Cal savings. Next slide, please. So we'll go over some advocacy strategies of what you can do now to oppose Medicaid cuts at the federal level as Californians. And like Natalie said, the House majorities, margins especially, are very narrow. Oh, excuse me. Um, they are very narrow, and so really targeting our Republican representatives in California and making sure that they know that in California voters oppose Medicaid cuts is going to be our best strategy at this point to prevent any sort of Medicaid cuts. And you can do that by calling or writing your members of Congress. And we have a sign-on letter that you can sign on to. And then really looking and targeting these three districts here, California 22, 40, and 41, where we have very high Medi-Cal participation rates in those counties, and these are Republican districts. So if you know anyone in those districts, you've got consumers there, people who are using Medi-Cal, then reach out to them and spread the word. Next slide. Oh, so we're going to actually take a couple of minutes to pause and ask that you call the number on the screen, and you'll be connected to your member of Congress. You just have to put in your zip code, and you'll be connected to your appropriate member of Congress, and you can tell them on the phone right now that you oppose any Medicaid cuts, and that you want them to represent you by rejecting any Medicaid cuts in the current budget process. So I'll take a pause for just a minute to let you do that. Yes, I think there is value in calling our Democratic members. I think the more that we are out there calling and letting every member know that we're opposed and that we expect them to fight for us, we'll make sure that people show up that our representatives show up to the voting time and put in their vote and speak out, and that they have their constituents behind us. So yes, I encourage you to vote. To call. I called this morning. I had my kids call, my parents call. Everyone should call. So this number went on the family WhatsApp chat today. So we have a fact sheet that I think we can post a link to right here. So if you give us a minute, we can put a fact sheet on the chat that you can use. I'll give one more minute just in case you're having connection issues. Okay, we'll go to the next slide. Hopefully that was enough time. Great. Okay, so we also think education is really important, and that's really targeted education to policymakers and the public about why Medi-Cal is important for older adults. Not everyone actually knows what Medi-Cal is and doesn't understand that the services that they're getting are actually paid for by Medi-Cal. So IHSS recipients, IHSS providers, for example, talking about sharing information and resources about what the services that people are getting are doing for those individuals. Why are they important? Why is it important for older adults and people with disabilities to receive all of these services in order to ensure they can remain in their home? And also, people might not realize that actually their services are at risk of cuts. And so really talking about all that's happening in the federal level and how that might impact consumers in your community is going to be very important. And then we are collecting stories and about people's why Medi-Cal is important for Californians, who's using these services, where they're living, how is Medi-Cal supporting your constituents? And so sharing those stories with us and with other advocates who can take them to Congress is going to be very important. You can publish these stories on websites and on social media, and then identify people who are maybe willing to share stories with the press, with both Justice and Aging and other organizations who are trying to go out there and talk to the media about the impact of cuts on Medicaid recipients. Next slide. And then we also think that this is a good opportunity to start connecting with other groups, family caregiving advocates, AIDS, HIV advocates, Alzheimer's, and veteran groups, unions and labor representatives, all of these groups that might not usually talk to one another. Now is a really good time to work together, educate one another about about the impact of Medicaid cuts on these different groups and opportunities to advocate and to fight them federally and in the state. And then reaching out also to the state and being active here in California to let not only advocates, but also state and federal officials know why Medi-Cal is important to you. And then reminding also or finding connections, I think, with our representatives, looking at who they are, who's in their lives that might be in need of these kind of services. Do they have an older adult that they're living with or in their lives that might be impacted or that could relate to caregiving stories and to services stories will be important as well. Next slide. And like Natalie mentioned, we have to remind our constituents and our communities that it doesn't matter how Republicans are framing these Medicaid cuts. At the end of the day, they're all cuts. Medicaid is necessary for all populations, kids and their parents, older adults, and people with disabilities, and also individuals who are in the Medicaid expansion groups. And so instead of pitting populations against each other, really seeing Medicaid as a program that supports all of our communities and anyone who needs healthcare and support services. And yeah, so I just leave it at that and on the next slide. So here are some places where you can get involved, and you can join Justice and Aging and receive our updates and our resources. And you can also join the Protect Medicaid space at listserv and our Fight for Our Health coalition. Right. We have some resources that are going to be passed around through the PowerPoint, and then we'll take some questions.
Thank you, Hagar. And just want to encourage folks to get myself on camera here to ask questions in the chat, or you can use the Q&A feature. Either way, we'd love to just open it up for discussion. All right. Looks like we have somebody with their hand raised. Debbie, do you want to jump in?
Yeah, hi guys. Debbie Toth from Choice and Aging. Thank you so much for doing this. I know that many of us have lost a lot of sleep since this came out last week and was fast tracked to a week. And I know Hagar touched on this a little bit in terms of like we're calling in California, in many parts of California, we are calling and preaching to the choir. How can we get others more engaged throughout the United States? So I saw in the chat that there was a listing of all the Republican Congress members in California and the percentage of Medicaid in their particular district, percentage of Medicaid beneficiaries in their district. I'm wondering if such information exists for all the counties throughout the United States, and can we target our social media postings to those zip codes, or like what are strategies that we can use to really call this out and elevate it? Thank you. Thank you guys for doing this.
Thanks, Debbie. Yeah, I just put in the chat a link to a brand new resource from the Center for American Progress that has information for every single congressional district in terms of Medicaid enrollment and also the budget loss, the funding loss they would see if $880 billion was enacted. So we've seen a lot. I mean, it's really helpful for a member's own constituents to be weighing in, but we've seen a lot of really good strategy, especially in California, working together to target those districts where, members may be willing to vote against something like this, willing to protect Medicaid and join with the Democrats to do that. And so I think, within a state, it's really helpful to be supporting neighbors and other congressional districts to get them the information, help them make these points. And also, we've heard about several people who, rely on home and community-based services, and maybe they are also a caregiver for their mother or grandmother, or a family member of theirs helps them out, and that family member lives in a different district that is a target. So just really thinking expansively about connections to the members that we're seeking to get to support Medicaid.
And I would also say, oh, I'm sorry.
Go ahead, Hagar.
I would also say, I think that Medicaid, even if it feels like preaching to the choir, Medicaid doesn't mean, or Medi-Cal doesn't mean the same thing to everyone. And so really uplifting all of the different areas in which people, or different ways that people rely on Medi-Cal is important, and clarifying, talking about administrative burdens and how difficult it is for people when we put administrative burdens, like work requirements, for example, how difficult it is for people to access services and what impact that has on consumers, I think is also a really good opportunity. I think, not everybody, even at the, in a representative level, really understand what it means for a person to have to prove that they don't have to abide by work requirements or seek work in those kind of required processes. And then, talking about, for example, CBAS, like what does adult day health do? Why is it important for Medi-Cal recipients? I think those sort of details really have an impact in a way that even people who support Medicaid don't really always understand or can kind of think through. So.
Thanks. I'm seeing a question from Vivian about accessing the sign-on letter, and I just want to share because I know we have a lot of this going in the chat too. Folks wanting the presentation, wanting the recording. That's what I'm going to do right after we log off. I'm going to try to package this and make sure that everybody who registered, definitely folks that are joining us today, have access to these resources. And then beyond that, if you have any questions or need to be connected to additional resources, please feel free to reach out. You could reach out to me. You could reach out to our amazing team at Justice and Aging, and we'll do our best to support you. So thanks for that question, Vivian. And then I see a hand raised from Roberto. Do you want to jump in the conversation, Roberto? You might be muted.
Um, I actually have a question. This is Kathy Kelly.
Oh, hey, Kathy, you logged in as Roberto.
I know, hi Roberta, I know you're on this call too. I don't know why we're both on here the same, but I just wanted to ask, are any of the basic information, consumer information pieces, are they translated into like Spanish or Chinese or anything else, any other languages? Did you hear me?
Yes, I'm not aware of any, but I don't know, Hagar, if you're aware of any California resources that are translated.
Okay,
But
so Hagar, maybe I'll reach out to you when we can talk, and there's some basic information we might be able to translate for you.
Great, thank you.
Mhm.
I see a hand from Jonathan. Jonathan, do you want to jump on?
Yeah, thank you. I'm in Marin County, uh, and I work with a group where the people that we help with have quadriplegia, and they're going to be hit hard. Uh, and about I think 1 out of 5 people in Marin, though, even though it's a wealthy county, are on uh, Medi-Cal. Um, I'm assuming that it's a good idea for some of the nonprofits and other folks who are going to be impacted to try to form local groups to help some of the folks who will lose some of the funding. They'll lose in-home care. It will cost more for food. Rather, they won't have as much money for food, and so on. And I mean, I could do some quick thinking about how to organize all that, but I would assume that's something that would be on our radar locally. I know it's something that I've thought about with the group that I work with, and also the Center for Independent Living group I work with called InSpirit. We have 15 clients with quadriplegia to whom we give $700 a month. They can use that to purchase more care or more food. We don't limit them as to how they do that because we want them to be independent. So, any thoughts you might have on such that kind of an organization? Because I think it's going to be, uh, something that's going to be necessary, unfortunately. Thank you.
I'll weigh in. I'm not sure I'm aware of any at this point. I think that our focus right now is to really try to beat these cuts. And I wanted to just jump in and say that like I think that's what we're hoping is that we can all um coordinate and fight this off to make sure that nobody loses their services and that nobody is in a position where they need to choose between health and food security and housing security. And the more we uplift that as the choice, I think the more, and as a united front, the more effective we'll be in fighting this off. I don't know if Natalie, if you have something to add to that, but.
I agree. And I mean, forming that community and group now to advocate against the cuts is a great idea. I think yeah, we are sounding the alarm here of this is a real and urgent threat, but at the same time, it's a fight that we can win. We stopped these cuts in 2017, and it was largely thanks to the disability community and their advocacy. So we're here to do that again.
Thanks. I've got a question in the chat from Elizabeth, who says, one can look at districts across many states with representatives that are likely to support these cuts and also have high numbers of impacted individuals. I believe someone shared those percentages in the chat earlier. The question is, how easy would it be to mobilize the impacted individuals to vote out the representatives who may be supporting the cuts and indicate knowledge of and desire to support potential people running that would advocate for continued funding of these elements? Any thoughts on that?
I mean, I don't think we can speak to that as a 501c3. We don't engage in voter mobilization, but there are groups that are working on that front.
Thanks. And either way, I mean, I think this is moving through the House and eventually the Senate very quickly. And so I don't know that elections would mitigate what's happening now. I think it could be something to focus on in the future, is mobilizing these communities. A question from Sarah. You mentioned gathering success stories about how Medicaid supports aging populations. Do you recommend that we include that in our sign-on letter template that we send out, or should we just send those to you?
Both. Both would be great. The stories, you don't have to treat them as like a one-time thing. You know, we have multiple audiences. I was going to say too, that's another really helpful thing if you have Democratic representatives is giving them stories that they can then use when they're, you know, making the case and arguing against these cuts in Congress.
Thanks. A question about messaging, if you'll entertain it. So we know that access to healthcare, social services prevents health deterioration, if you will. And we know that having home and community-based services and regular doctor visits keeps us healthy, keeps us out of the emergency room, keeps us out of more costly institutionalization. And so I'm just wondering, you know, is that a message that we should be conveying? Is that these cuts are very short-sighted, and that they might result in savings now, but they will not result in savings in the future? Or is that a message that is just not really getting across?
I think that's a good message. What we've seen from testing is that the first message testing that other groups have done is that the first and most important message is to be clear that these are cuts and that people will lose coverage. But beyond that, and particularly with members of Congress directly, I think it is absolutely helpful to point out those short-sighted arguments. Talking about the impact on hospitals, especially in rural areas, is really persuasive. And that's yet another way that these cuts also harm people with Medicare. If the hospital closes in their community, it doesn't matter what kind of insurance you have, you're losing access to health care.
And I'm just looking at the chat for any more questions. Feel free to raise your hands if you want to jump in the conversation. We do have just a couple more minutes. We certainly could use that time, or we could adjourn early. Eric, do you want to jump in? I've unmuted you. You might have to unmute yourself.
Yes, I want to share, just put a plug in. The Village Movement California has an incubator program. And in that program, we train communities to mobilize against or to assist older adults. And right now we're working to remain current and relevant in light of all of these changes. And so we've included in the incubator program an advocacy module where we're actually training the folks in these various communities how to reach out to their legislators and how to advocate for themselves. So Please give us a call. Let us know if there's any way we can support you or support anyone in your area. And we're happy to try to work with you to make that happen in your communities.
Thank you, Eric. All right, and with that, I think we will adjourn. I think there's a ask of you, Eric, to put the link in the chat. How do folks connect with you? Any updates on Older Americans Act funding?
Yeah, I would recommend subscribing to Justice and Aging's email list and updates for the latest on that. Yeah. We're not the right team members on Justice and Aging staff to provide those updates, but we are following them closely.
Awesome. Well, thank you everybody for your time. This has been a really productive conversation, lots of good information. Kudos to the teams at Justice and Aging for not only tracking this, which is changing constantly, but being so engaged with community members and organizations and sharing information, empowering us to go out and do things and be active and participate in this process. So love, appreciation all around. I hope everybody enjoys the rest of their Tuesday. Stand by. We'll get the slides and the resources out to you so you have them at your fingertips and can immediately start to engage and share. And please feel free to reach out if you think of anything else, if there's anything else we can do to be supportive. And with that, we're going to close the webinar. Thanks, everybody.